State Representative David Bowen in Milwaukee, Buffy Riley in Hayward, thanks for joining us on Up North News. We appreciate you being here today and telling us about your experiences with this coronavirus pandemic so far. Let's start, Buffy, with you. You are fairly recently back in Wisconsin after working with people in New York with patients there. But tell us briefly how you're doing. You've finally been able to return to your house, but life is far from normal yet. What has life been like since you got back to your house on Friday?
Well, it's very, excuse me, it's very good to be home. But there's still a lot of mask wearing. I don't get too close to my husband because I don't want him to get this. So we stay probably a good 10 feet apart. If I need something in the kitchen, I wait till he's out of there. And I go around with my Clorox wipes so that I can be as careful as I can that he doesn't get this. But it's great to be home. It's great to be sleeping in my own bed. I miss that. So,
David,
yeah.
when you contracted this, were you at any point hospitalized, or was it completely home care that you were getting? What was your experience like?
Essentially, I didn't have to go to a hospital or beyond my regular doctor's check-in and getting tested there. And it was one of the few tests that he actually had access to. So this was actually really early in the pandemic rolling out. And I was barely able, but was able to get a test from my doctor. But thankfully, I did not have to be hospitalized.
Now, you're a couple of weeks ahead of Buffy in terms of when you contracted this. How are you feeling right now, and how bad would you say it got for you?
Well, right now I feel completely healthy, so thank you God. As it was undersold as just the flu, it was the longest just the flu I ever had, which means it really was not just the flu. I think it was very undersold to our communities of what the impact really would be. And, essentially 2 weeks of having fever and coughing and, shortness of breath, when that really does impact your lungs, you feel it. You feel that you can't breathe like you normally would.
And Buffy, as far as you, I mean, we can hear your cough. And again, for folks that think that this is, again, just a really bad flu, talk about what it is like for breathing, your lungs, the coughing. And it sounds like you're going to have this for a while yet, just the way you're sounding when you cough.
I don't know how long it's going to last, but I know that with my symptoms, and I'm really glad that Representative David could get tested, because I could not get tested. And I never had a fever. And they said, as long as you don't have a fever, you don't get a test. But I never had a fever with this. So when I talk about when am I going to be over it, every time somebody talks to me, they say, well, as long as you're 72 hours without a fever. And I said, I've never had one.
Wow.
Can't go by that criteria. And then we don't have an effective test for antibodies. So we can't look at that as a predictor of, first of all, any kind of immunity, or second of all, whether I'm still a contagious person or not. All we can do is do the virus test. And I am longing to get back to work and some semblance of my life again. But I work in a hospital, and I can't go back there and think that my mask is going to keep anybody else from getting it. Even at home, as I said, when my husband is in the same, I wear a mask 90% of the time in this house.
It's interesting to hear Buffy's experience of this virus affects people in different ways. And there was so much misinformation about how to go about receiving services and receiving care that some people were making the decision on their own, coupled with the experience of not having health insurance, of ending up in a predicament where you would end up in incurring costs that you could not afford, or going to the hospital only to find out that they sent you away because you can't wait in the waiting room, or that you have to make an appointment to be seen, or there's some other process to be seen at a different location. It was just a lot of confusion that people were not used to.
But let's move from the healthcare side of things for a moment to the policy end of things. You talked about the people who, are hurting, and here's Buffy as an example of somebody who can't go back to work. There's we don't know her own financial situation, but tell me where you think state and the federal government should be on this matter of dealing with individuals who have been ailing and may have some real financial insecurities and lack health insurance and things like that, David.
Yeah, and essentially, this is why we need a federal response to things of this magnitude. It always can't fall on the local or state level to be able to fill in the gap when things like this happen. And out of all of where resources were placed to look out for industry and the economy, working people were kind of put last, right? And we know that there was a stimulus check sent to families that qualified, but we know that there are a ton of folks that either received that payment very late, are still having a tough time getting access to unemployment right now, unemployment insurance, and being able to still stay afloat. So you have small businesses that they qualified for the PPP, but they really could not get through to get their applications and loans covered.
Were there a lot of similarities between what we're hearing from Milwaukee, what you saw in New York, and maybe what you've heard since then?
Well, I'm not familiar firsthand with what's happening in Milwaukee. I can tell you that when I worked in the ICU, everyone was on a ventilator in my ICU. Maybe there was somebody who wasn't on a vent, but I was never assigned to a patient that was not ventilated. I know that when patients needed dialysis, because when you have a disease that's running rampant, or virus running rampant through your body, one of the things that we saw with this quite frequently, and Representative Bowen alluded to it, is that there are people that are at higher risk for complications. People with diabetes, high blood pressure, congestive heart failure, and chronic obstructive pulmonary disease, COPD, are all at greater risk. Well, not everybody in my ICU had those risk factors. I saw plenty of young people in there too. I mean, people in their 30s, otherwise healthy young men.
In Milwaukee, we aren't seeing things change, which means we still need to continue to have some safeguards in place so that we are not making this situation worse. There are folks that I know that have lost their lives to this virus. One is a mentor of mine in the Milwaukee area that used to work for the police department in leadership. His name is Leonard Wells, an amazing community member. I don't think he should die in vain of us making these decisions without the proper precautions in place to save more lives.
And where people do have more distancing, just naturally, there's been some talk about why don't we reopen? We don't have the cases. It's all in Milwaukee and Brown County and in Madison area. So we think it's time to reopen. I'm curious, both David, your thoughts and yours, Buffy, because you do live in Hayward. You live in that area where a lot of people are advocating for reopening.
I think no one should undervalue just the toll that it is taking on all of us. At the same time, if we really want to make sure that all of our sports come back, which includes the Brewers are playing and games at Miller Park, and the Bucks are playing on their way to a championship at the Pfizer Forum, and the Packers, Lord have mercy. We cannot forget the Packers. And another chance at a championship ring with Aaron Rodgers at the time when we all want those things. If we really want to plan to get those things back as soon as possible, we have to be smart about this. And in the meantime, if there are parts of the economy that are not, that can't operate, let's look out for those business owners, those residents, those workers that are working, and they need the resources to get by. And we cannot leave them, out of luck and not supporting them fully. So I want folks to know, I saw the protests, people that showed up. And I understand their pain. At the same time, we know that I think about 70 people ended up getting the virus from those massive protests.
So far.
And that's why we need to ensure that we aren't making decisions that are just out of our frustration. This is just not the time to do that.
If we saw anything like what I saw when I was in New York, it would be quite difficult to maintain in our rural critical access hospitals. Spooner, Hayward, Cumberland are all critical access hospitals. So that means we have a capacity of 25 beds. Most of us are not prepared to deal with large numbers of people on ventilators. As far as reopening, one of the things that concerns me when I see these people protesting and screaming for their rights, as I see it, to go infect other people. I don't think people are thinking through what they're really upset about. I think that people are upset or feeling disaffected or whatever it is they're going through that's making them pick up assault weapons and going to Capitol buildings to protest. That's bigger than COVID. Arming yourself and going to a Capitol to protest is bigger than COVID.
And I think that's what really is hard for people to fathom, what happens when hospitals are not designed to have enough beds and help for everybody who needs it. And once you get to that wave of a scenario, you have to decide which lives are you going to support and save, when the capacity to help everybody is not there. And that's what's hard for people to fathom that are protesting. They don't know what that looks like until it actually hits them and their community.
David, you told me before that you're pretty positive that before you had tested positive that you ended up giving the virus to 3 of your friends and only one of them was able to get a test. And now, Buffy, I'm interested in hearing your thoughts, obviously in Milwaukee where it's been a hot spot for the better part of 2 months now. And now, in Hayward where there might not be enough testing, but it could be a hot spot, who knows? Kind of the need for testing and more available testing.
And I'd piggyback on that as well, Jonathan, to say, maybe the reason why this is like it is was the, reported lack of early planning by, the Trump administration and taking this threat seriously enough. Does that play into your own personal feelings, David and Buffy, about why we're at the point where we're at? David, we'll start with you.
Sure. I mean, the president of the United States called it a hoax, right? This was supposed to be just this made up thing that from the media of, things not being in place, that the virus wasn't going to be that big of a deal, that we would just get through it, that everything would be fine. And now we're seeing that that's not the case with 70,000 deaths later. When you talk about something of this magnitude, you just know for a fact that there is a better way in how to operate in responding to health crises like this than what we've seen, than what we have just experienced.
Well, the Trump response was absolutely abysmal, and that administration needs to shoulder the blame for a lot of the spread of this. The day that I left for New York, April 3rd, or the day I arrived in New York, which was April 3rd, there were 7,000 deaths nationwide. Right now, we're at almost 80,000. That's 2 months. Not even 2 months. 80,000 deaths from this. I think at this point, the only way that we're going to be able to get a handle on it is 2 things. 1, test, 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 test. That means a lot of people are going to need more than 1 test because we don't know enough about this virus to determine how long somebody's positive, as in my case, or who has it, who doesn't have it. So we need to ramp up testing, number 1. And number 2, we need a vaccine. And so far, the Trump administration is refusing to work with any other countries who are trying to develop a vaccine at this point. And all we get out of that administration are lies anyway, so I don't know that I would be able to believe anything they said at this point. But taking funding from the World Health Organization at a time like this is short-sighted at best. We really need to start working together with people across the globe to try to figure out a vaccine for this disease.
Well, Buffy and Representative David Bowen, we know you were part of the statistic of 1.3 million Americans so far who have contracted this. We are so thankful that you aren't part of some of the other statistics that we've already talked about, and we are so thankful that you joined us for a time today to talk about your experiences. Thank you again, and we wish you all the best in your continued recoveries.
Thank you so much, Pat, for having me on.
Thank you.
Thank you, guys.